am going to start my auscultation. I'm going to clean it first. With this, you tell me if you have any pain with any of the things I do. I'll try to warm this up really quick. Alright, so I am going to start in the right lower quadrant, and then we'll work my way around. So right now I'm listening for vowel sounds. So I did hear active vowel sounds. In the clinical setting, you would need to listen to each quadrant for 1 whole minute in the presence of vowel sounds. You should hear 5 to 30 per minute. If they were hypoactive or you didn't hear any vowel sounds, you would then need to listen to each quadrant for a total of 5 minutes and then assess from there. And so now I'm going to listen to your aorta. I'm not going to press very hard. I'm going to be listening to your renal, iliac, and the aorta pulsations. I'm going to listen with my diaphragm first, and then I'll switch over and listen with my bell.
Done. You want the rest of the place?
Okay, thank you. All right, now I'm going to be listening to the renal arteries. Alright, now that I've identified all the pulsations, I can move on to my bell. With the bell, I don't want to press very hard because then I'll just make that a diaphragm. Alright, with that, I didn't hear any irregular heart rhythms. I heard the S1, which is also known as the love dub. So, no abnormalities noted. And I heard that with all your aortic, iliac, and renal arteries. So now I'm going to start percussing. Let me know if you feel any tenderness with this, or pain, or if something doesn't feel right to you. So with this, I'm going to be tapping on my middle finger and listening for timpani. Timpani would be that's on a hollow organ or known as an air-filled organ, so like the stomach. And then you have your solid organs, which are going to be like your liver, your pancreas, and those are going to be dull sounds. So I'm just going to be tapping around. That was your stomach, and I did hear that timpani. Okay. So now I'm going to be doing your percussing your liver in specific. I am going to be measuring this in centimeters. Normal parameters for this liver margin test is between 6 to 12 centimeters. So what I'm going to do is I'm going to start percussing here, and once I hear dullness, I'll mark that area with my pen, and then I'll keep going, and once I hear the dullness leaves, then I will mark my pen there, measure that. So let's start down here. Just gonna make a small little mark there. So I have 8.5 centimeters, so that is within normal parameters of the liver.
Okay, so Courtney, I'm going to move on to the abdomen, so I'm just going to be lowering the table here, so just steady yourself for a second. Great. So on inspection of the abdomen, the umbilicus is centrally located, just a few nevi, nothing worrisome. I'm going to go ahead and take a listen once again.
Is it back up?
Yes, you can put that up, sorry. Okay, so normal abdominal sounds, no bruise heard on auscultation of the abdominal arteries. And I'm going to just go ahead and percuss.
Okay.
Feels a little different, but it helps me hear what's going on underneath. Great. And then I'll get you just Great, and with this hand, can you just mark that point with your finger? Great. Okay, so the liver is found to be about 7 centimeters in the midclavicular line. And Courtney, I'll get you to take a breath in. Out, great. So splenic percussion sign was negative. And I'll get you to just lift your knees.
Okay.
Okay, and just let me know if there's any pain with this? No?
It's okay.
Okay, I'm going to go a little bit deeper. Okay, so no palpable masses in the abdomen. And I'm going to get you to take a breath in and out. And a breath in and out. And a breath in. Great, and out. Okay, so liver was palpated, the border was free of nodules. And again, a breath in and out. Breath in and out. And a breath in and out. And in again. Okay, so spleen is non-palpable. This one's uncomfortable, and my hands are cold, I'm sorry. So take a breath in and out. Okay, and I'll go around this way. And like we did on the other side, a breath in and out. Okay, so kidneys are non-palpable.
Okay, Mrs. Chua, now we're going to move on to the abdominal exam. Okay, so I'm just going to have you raise your gown to just below your breasts. I'm going to lower this a little bit more so I can get a good inspection of your abdomen. Just have you bend your knees up so we can relax your abdominal muscles. Good. And again, I'm inspecting for any obvious masses or hernias or pulsations. Okay. Have you bring your head up, again checking for hernias, and relax. Good. Okay, now I'm going to auscultate the abdomen, and we'll auscultate at a minimum at 4 quadrants. Okay, and you have positive bowel sounds in all 4 quadrants. Now I'm going to go ahead and auscultate the aorta using the bell. And there are no bruits. Okay, next I'm going to percuss the abdominal quadrants. And percuss for the size of the liver. And it should be between about 6 and 12 centimeters. Okay? Now we'll go ahead and palpate the abdomen. First lightly. Just tell me if you feel any discomfort.
Okay.
And then a little more deeply. Okay? And now I'm going to palpate your liver. Go ahead and breathe in for me. And out. Good. And palpate the spleen. Go ahead and breathe in. And out. Good. And palpate for the kidneys. And for the kidneys. Okay? And then I'm going to palpate the size of the aorta. And that is very normal. Okay.
I'm just going to feel your tummy now. Does it hurt you anywhere?
No.
Good. Now I just want to feel a bit more deeply. Not hurting you. Good. I want to feel for your liver. If you could just breathe in and out deeply. Good. And just keep going with deep breaths in and out. Okay. Just going to feel your left kidney. Could you just roll towards me a little? That's good. And now just rest back. Okay, same on this right side. If you could just roll away from me and rest back again. Good. Now I'm just going to tap on your tummy. Okay, and last thing is just to listen for some bowel sounds. That's fine. Thanks very much. Would you like to do yourself up again?
looking for peristaltic waves or any, visual movement of the bowels, of which I see none. Okay, and just looking at the general symmetry and everything. Next thing I'm going to do, now that I've looked at the contours and symmetry, I'm going to auscultate over the aorta. I'm going to listen for bruits at the aorta. Moving out to the renal and iliac arteries. I'm going to auscultate down here by your femoral artery, okay? On both the left and the right. First, palpate the femoral artery. Okay, going to flip to the diaphragm. We're going to listen in all 4 quadrants for bowel sounds. Present immediately in left upper, right upper, right lower are present, and left lower. Very good. Okay, now I'm going to percuss in some different areas of your abdomen. I'm just going to be listening for sounds, resonance versus tympany versus dullness. Okay, I'm going to start here. We can go ahead and find the lower border of the liver here. Get the change in tone, the dullness, back to resonance. So it appears that the liver span would be between 6 to 8 centimeters there, which is normal. I'm going to palpate over here. Near the spleen, splenic area of dullness. Tympanic and slightly tympanic, but more resonant sound here over the other areas, quadrants of the abdomen, which is a normal or expected finding. Okay, now I'm just going to palpate lightly, just going to feel around in here, looking for any swelling or any anomalies there. Okay, just light touch. I'm going to go a little deeper now, and you tell me, try not to tense up. Let the abdominal wall move slowly, or just move freely. Any tenderness when I do this? Okay. No guarding here. I'm going to look for a little rebound tenderness over McBurney's point. Deep breath in. And when I let go here, any tenderness? Okay, good. So negative for McBurney's point. Now I'm just going to listen as we do this scratch test over the liver. Okay, we can clearly demarcate the border of the liver there. Now from the top. Okay, so we can more closely estimate the actual span of the liver with that technique.
Your aorta is malfunctioning, you might have an aneurysm. So I'm going to go ahead and take a peek, and then we will listen in all 4 quadrants. Alright, your bowel sounds are normal and active in all 4 quadrants. I'm going to go ahead and listen for some bruits in your abdomen as well. So we're going to listen to your aorta. Alright, so no bruits noted in your aortic, renal, iliac, or femoral arteries, so that's good. I'm going to go ahead and percuss your abdomen like we did with your lungs. And I'm going to percuss the span of your liver. Alright, so the span of your liver is about 6 centimeters, which is normal. I'm going to go ahead and palpate very lightly. Just tell me if you have any tenderness or pain. Feel okay? Mm-hmm. Alright. So I'm going to press a little deeper this time. Feel okay? Mm-hmm. Alright. So go ahead and take a deep breath for me and let it out. I'm going to feel for your liver right up into your ribcage. The liver is not palpable. I'm going to feel for your spleen. Your spleen is not palpable, which is good. We wouldn't expect to feel it. I'm also going to palpate for your kidneys, so I'll have to press a little bit for this one. So. All right. And kidneys are not palpable, so that's good. We wouldn't normally feel them. And finally, I'm going to palpate for your aorta. Your aorta measures approximately 2 centimeters, which is good. I would expect that. All right, finally, I'm going to check your inguinal lymph nodes, the horizontal and vertical chains. Sorry, I know it's a little hard. And then finally, we're going to do your abdominal reflex. But this will make you ticklish, so I'll go ahead and warn you. There you go. Excellent. So that's intact.
Okay, so the general contour of the abdomen is relatively flat, okay? Then I'm going to be listening for the aortic pulsations, and generally for a thinner patient, they're going to be stronger. So we'll see right here. And you have faint aortic pulsations. Next, we're going to be listening for any bowel sounds, and you're going to start in your right lower quadrant, then move on to your right upper quadrant, left upper, and left lower, going around. And if I didn't hear any sounds, I would do 5 minutes in each quadrant just to see if I could hear anything. And if I didn't, then I would be a little more worried about that. And then I'm going to palpate, okay? Any pressure? No. Okay. Good. So you're soft, which is good, and you're not firm. Okay? So you can sit back up for me.
En la normalidad, salvo en el caso del hipocondrio derecho, donde por la presencia del hígado encontraremos un sonido más mate, y en el epigastrio encontraremos un sonido todavía más timpánico de lo normal en el resto del abdomen. Esto es en presencia de normalidad. En caso de ascitis, por ejemplo, un signo que lo desvelaría sería que en el epigastrio se notaría un sonido timpánico en el cúbito supino, pero al girarse la paciente, el líquido se pondría hacia abajo y entonces oiríamos un sonido más bien mate, que no es el caso porque la paciente se encuentra en la normalidad.
I'm going to pull your shorts down just a little bit. Everything sounds good, lots of bowel sounds. Now I'm going to percuss, okay?
Your aorta was also very strong when I was listening. Alright. And now I'm gonna palpate your stomach. So I'm gonna start with a light touch. Let me know if anything becomes uncomfortable. And now I'm gonna go into a deeper palpation, so please let me know if it becomes uncomfortable. All right.
To the level of the patient. So I'm just gonna gently feel. Sorry about that. Okay, going in a bit deeper now. A bit painful there. Okay. Okay, I'm just gonna feel for his liver now. So would you be able to just take some nice deep breaths in and out, Luke, for me, please? Breathe in. Right, sorry about that. Sorry. Okay, I'm just gonna tap on your tummy now. Okay. Okay. Right. Okay. Just gonna feel for your kidneys now. Lift your back up a bit. That's it. Rest it. Okay. That's great. Okay. Just gonna have a listen.
1 minute remaining.
1 minute more.
No evidence.
No bulges or masses. It's symmetrical in the lateral aspect. Let's see. Umbilicus is midline, centrally located, looking normal. Let's see here. Contour again is flat. Let's see. Lift your head for me. Perfect. Lay back down. And I didn't see any hernias up here. Okay. Let's see here. I do see another papule, and again, everything else looks normal and where it's supposed to be. Now I'm going to auscultate for vowel sounds. And then friction rubs as well with the diaphragm of my stethoscope. Okay. Okay, now over the liver. And over the spleen. Okay, vowel sounds are active with a rate of 5 to 35, no friction rubs over your liver or spleen, okay? Now I'm going to listen to any, to your arteries, your abdominal arteries with the bell of my stethoscope, okay? So beginning with the aortic. Renal. And iliacs. Okay. Any pain or tenderness there? Okay, now I'm going to auscultate, okay? Okay, timpani was heard over the stomach and intestines, and then resonance over the bladder area, okay? I'm going to palpate. Any pain or tenderness? No. Okay. Stomach is smooth and soft. No bulges or masses noted. Now I'm going to palpate for your kidneys by grabbing the sides and pinching them in between. Any pain there? Okay. Okay. Kidneys are feeling smooth, round, and small. Now I'm going to palpate your liver as well, okay? So go ahead and take a deep breath and cough. Okay. Liver's feeling firm and smooth, no pain there or tenderness, right? Okay. Go ahead and sit up for me.
Let's make sure your draper's up here, and if you can just lift up your gown so I can see your belly. Good. Good bowel sounds. Okay, I'm going to push on your belly. You let me know if it hurts you, okay? Does that hurt?
No.
Over here?
No.
Over here?
No.
Pain over here?
No.
Pain over here?
No.
Any pain up here?
No.
Okay, good. I'm just going to examine your spleen here, make sure that it's the right size. And that is. And now your liver. Okay, good. Okay, we're done with that part. We'll put this back down.
I'm just going to be listening. I'm going to be tapping. Let me know if anything is tender. Okay. I'm going to be pushing lightly. Any of that tender? Anything tender there? Any tenderness there? No. I'm going to be pushing a little bit harder now, okay? Anything tender here? No. No? Any tenderness anywhere there? No. No? Is that tender up in here? No. No? Take a deep breath very quickly. And out. Did that hurt at all? No. No? All right. When I push right here, is that tender at all? No. No? And then I'm going to push on this left side. Does it hurt here? No. Does it hurt anywhere else when I push right here? No. No? Okay. Now I'm going to push hard, and I'm going to lift off very quickly. You let me know if it's tender, okay? Does that hurt at all? No. No? Okay.
And pull this down so we can lift your belly. And this all looks just fine. Lift your head up for me. Just pull your whole head and shoulders forward. Okay, good. Now I'm just going to listen to you. And I'm just going to pull down here and listen over your femorals. And in here, listen over your femorals. Okay. Oh, sounds good. Now, I want to check your carotid against your femoral. Sorry, that's way down there. That's okay. And while I've got access to both your hands, I'm going to just check all these other pulses too. Okay. I'm just going to tap on a little bit. Okay. And just palpate a little bit. Have you had any bladder problems?
No.
Okay. Good. Now I'm just going to mush on you and feel your aorta here. Okay, alrighty. And since everything seems to be just fine, I'm not going to bother to check your liver or your spleen because you don't have any symptoms that would suggest that we need to do that.
Okay. Lift your shirt up a bit. Okay, I'm inspecting for the contour. Your contour is flat, and I'm going to use my pen light to see your symmetry. Okay, you have even symmetry. Your umbilicus is inverted. Your hair is evenly distributed. And I don't see any extra pulsations or movement. Next, I'm going to auscultate for your vowel sounds. Starting in your right lower quadrant. Okay, your vowel sounds were present. They were normal between 5 and 30. Next, I'm going to auscultate for your extra, your vascular sounds. I'm starting with your aortic, your right and left renal arteries, your right and left iliac, and your right and left femoral. Okay, and next I'm going to do some light and deep palpation. You're going to feel my hands now. Palpate lightly in all 4 quadrants. And then deeper. Checking to see for any enlarged organs or anything like that. Next, can you breathe in deep for me? Okay, and let it out. Okay, felt your liver. And can you do the same for the next side? Okay, I didn't feel your spleen, so that's good. There's no enlargement. Next, I'm going to percuss all 4 quadrants, trying to hear appropriate tympany and dullness. Okay, I heard dullness over your spleen and your liver areas and appropriate tympany everywhere else. And next I'm going to have you put your shirt down. And you can sit up for me, please.
Okay, your abdomen is flat, has bilateral symmetry. Your umbilicus is midline and inverted. And all your nevi are under 1 centimeter, which is completely normal. Okay, now I'm going to listen for... I'm going to oscillate for vowel sounds, starting in your right lower quadrant. Okay, vowel sounds are present, high pitch and gurgling, which is normal. I'm now going to assess for brevis in your aortic, your right and left renal, your right and left iliac, and your right and left femoral. Okay, great, no brevis are present. I'm now going to do a light palpation just to get a feel for your stomach. Okay, did you feel any tenderness? Okay, good. I didn't feel any distension or rigidity or any masses. I'm now going to do a deeper palpation to get a feel for your organs, okay? Okay, any pain with that? Okay, your liver, kidney, and spleen were not palpable, and your aorta was about 3 centimeters wide and had a anterior pulse. Okay, now I'm going to do liver dullness. I'm just going to percuss. Okay, here's some dullness, which means I'm over your liver. I'm just going to go over a little bit till I hear some tympany. Okay, here's some tympany. That means I'm in the stomach region. Okay? Okay, great. That's all for that. You can put your shirt down.
Your middle finger of your dominant hand, in this case it's my right hand, and you strike the distal joint of your non-dominant hand middle finger. And it's a quick strike, 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 and then lift up so that you don't dull the noise. So I'm going to lightly just percuss in all 4 quadrants of her belly, listening for the tympanic sound, which is that sound of a drum, because in her belly is a lot of air, and there shouldn't be fluid or any structures that cause it to be dull. I'm going to percuss for the liver border, so I'm going to start in the mid-clavicular line around the umbilicus and percuss upward until it changes from tympanic to a dull sound. Once you hear that dull sound, you can mark that level, and then again start superiorly, go between the rib margins, because the ribs, if you percuss the ribs, they're going to be dull sounding. So you want to percuss in between the ribs until you hear the dullness, and then you want to mark that liver border. It should be anywhere between 4 and 7 centimeters or so. You can do the same thing on the spleen side. It's harder to percuss the borders of the spleen because the spleen is located completely under the ribs and off to the side. So what you can do is around the 10th rib, sorry, my hands are really cold, Miley. Around the 10th intercostal space, so count the ribs. You know the bottom rib is the 12th rib. Count up 11, 10, 10th rib. In that 10th intercostal space in the anterior axillary line, so the anterior axillary line, you can percuss here. And you're percussing to see if that's dull. If it's dull, and then you can have the patient take a deep breath in and percuss again. Good, and now it's tympanic. So that spleen is shifting up, so there's no splenic enlargement. The next part after you percuss the abdomen is to palpate the abdomen. I'm going to start with light palpation. Again, I'm using just the pads of my fingers and lightly palpating the right upper quadrant and the left upper quadrant, and then the right lower quadrant and the left lower quadrant. The light palpation gets the patient used to your touch, gets any of the giggles out, gets the coldness of your hands, gets them familiar with that, and it allows their muscles to relax in their stomach so that you can then go ahead and do some deeper palpation. In the right upper quadrant, when you deep palpate, you're going to deeply palpate for any of the structures there, and the main structure that's here is the liver and the gallbladder right behind the liver. So you're going to press down and then press up towards the costal margins. You can see Miley's ribs clearly here, so you want to press down and then up underneath the ribs to try to feel the liver border. You can have the patient take a deep breath in, and that liver will sometimes come down and that border will hit the tip of your finger. You can then go to the left upper quadrant and do the same thing. Press down and try to go underneath the rib margins to see if you feel any spleen. A splenic border here is not a normal finding, so you shouldn't actually be able to palpate the spleen. If you can, that means the spleen is enlarged. Deep palpation again in the right lower quadrant. The main structure that's down here is appendix. There's also bowel. In the left lower quadrant, deep palpation, going to feel the colon. A lot of times that can be tender. It shouldn't be real painful, but there is some tenderness associated with palpating that colon area. Other techniques with feeling the liver is called the hooking technique. It's hard for me to demonstrate in this position, so I'll show it to you on her left-hand side, which is obviously not where her liver is. But you take your fingers and you actually hook them underneath the costal margins, and you're hooking up this way. So you can actually see that's her rib right there, and I'm just hooking my fingers underneath her ribs, underneath the costal margins right here. And then I would have her take a deep breath and try to feel that liver border as it comes down and bumps against my fingers, which again, liver is not on the left side, it's on the right side, and you should all know that. While I'm pressing, another special test that you can do is called Murphy's sign. It's a test for cholecystitis. While you're deeply pressing down in the right upper quadrant and pressing for that liver, you can have the patient take a really deep breath, take a deep breath, and if the pain is so severe that it causes them to cease their inspiration, so it's a cessation of inspiration due to pain, that means that there could be some inflammation in the gallbladder. So if the patient is unable to take a deep breath while you're palpating deeply in that right upper quadrant, that can indicate some cholecystitis or gallbladder inflammation.
Shape and the symmetry of her stomach, and look for any abnormal pulsations. Next, I would auscultate her bowel sounds in all 4 quadrants with the diaphragm of my stethoscope. Next, I'm going to auscultate the aorta with the bell of the stethoscope and listen for any bruits. No bruits noted. Okay, so if I would auscultate each quadrant for 5 minutes if I did not hear any bowel sounds. So now I'm going to touch your abdomen. I'll use one hand and then I'll use 2, okay? Just let me know if it's too uncomfortable for you. Okay. You can go ahead and sit up for me. Thank you.
Okay, I'm just going to inspect your abdomen, so if you can just raise your shirt a little bit. Okay, good. Thank you. Alright, I know that the umbilicus is inverted on the midline to the body. I don't see any lumps, masses, lesions, abrasions, so that's good. I'm going to go ahead and also take some bowel sounds. Some yellow coal. Starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and you had normal active bowel sounds. I was able to hear in there, so that's good. Now I'm going to listen to your, I'm going to also take your arteries, abdominal arteries. Starting with your aorta. Okay, and your right renal, your left renal, your iliac, your left iliac, and your right iliac. Okay, I did not know any bruits there, so that's good. Now I'm going to go ahead and percuss. So again in the right lower. Upper quadrant, left upper quadrant, and the left lower quadrant. Okay. Was there any pain? Okay, no pain. There was general tympany throughout. There was donuts on the liver and the spleen, which is a normal finding. Now I'm going to go ahead and do a superficial palpation. Again, starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and I'm going to go in the same pattern, and now I'm doing the deep one. So I'm going to go ahead about 3 centimeters. And again, I'm just checking for any enlarged or displaced organs. Okay, good. Did you have any pain? Okay, good. No pain noted, no enlarged organs or displaced. Alright, I'm going to go ahead and palpate your liver for me. So just inhale, deep breath. Okay, exhale.
Okay, good. Your liver was smooth. I was able to palpate. The edges were smooth, so that's good. Now I'm going to do your spleen. Okay, again, big inhale. Okay, exhale. I was not able to palpate your spleen, but that's all right. That is also a normal finding. So, okay, that's good.
Which is great. I'm also going to note that she has an umbilical piercing, which doesn't seem infected. It seems completely healed, which is great. And then I'm also going to inspect for visible lesions, scarring, any visible masses. Then before I palpate, I'm going to auscultate each quadrant, starting with the lower right. Perfect. And I heard gurgling sounds within her stomach, which means that there is bowel movements going on. So now I'm just going to palpate and soft palpate and circular motions throughout each quadrant to assess for rigidity. I'm also going to look at Vivian's face to look for grimness, which I don't see. I'm also going to palpate for tenderness and any masses that I might have missed. And I don't see any. There's no rigidity, which is great. I don't see any tension either, and there's no abdominal pain or any abnormalities that I see. There's no tension either. So finally, I'm just going to palpate the bladder. Sorry, Vivian, I'm just going to lift this down a little bit. So I'm just going to palpate the bladder. I don't feel any distension, which is great. All right, perfect. So Vivian, I'm just going to get you to sit up. I'm going to start in the right lower quadrant and work my way clockwise from there.
Okay.
I'm going to be listening for bowel sounds to make sure that you have hyperactive bowel sounds.
Okay.
Okay, and then right upper, left upper, left lower. Okay. I'm also going to auscultate your femoral and your inguinal artery. So femoral right here, then inguinal. Everything sounds good. Your bowel sounds are active, and I heard them. If I were to not hear any bowel sounds for a minute, I would then auscultate for 5 minutes. And if I did not hear any bowel sounds, I report that and get some extra help. But you are all good. I heard everything, so that's good. Then I'm going to start by percussing in the right lower quadrant. So, is that okay with you? If my hands are cold, just let me know and I can warm them up with quick. But are they okay? Okay. Okay. Are there any pain or tenderness anywhere in your abdomen? Okay. If there is pain or tenderness, then I would not palpate that, and I would start. If there was pain right here in the left lower, I would not palpate that because you don't want to palpate any pain, any areas of pain or tenderness. So since you have none, I'm going to go ahead and start in the right lower quadrant and just palpate, light palpations. Is there any pain or tenderness there? Up here? This side? No. Okay, and then over here? Okay. Abdomen feels good, there's no distension, and everything appears to be okay with your abdomen, which is great. Next, I'm going to go ahead and perform all of your lower extremities. So I'm going to have you actually stay in this position until I have you stand up, but for now you're good. So first
So starting in the right lower quadrant. Okay. vowel sounds were present in all 4 quadrants, and if they weren't present, I would listen for a full 5 minutes just to make sure. So now I'm going to percuss. So you're going to feel a little tap in your stomach. Sounds and timpani were present in all 4 quadrants, right above the liver. It'd sound more dull. And I'm just going to palpate. So in the right lower quadrant, you shouldn't be able to feel very many other organs, if any at all, but the right ureter and the right ovary are down there. And in the upper right quadrant, you'd find the liver and part of the ascending colon and the head of the pancreas, and in the left upper, you'd find part of the descending colon and the spleen. And in the left lower, we'd find the left ovary and the left ureter. Okay, and I push it on for you. And I see no shadows, and the umbilicus is inverted. Okay, so now I'm going to listen to your vowel sounds, Miss Hanson. Okay, stethoscope might be a little cold. Okay, I'm going to start in the right lower quadrant. And now I'm in the right upper quadrant. Now I'm in the left upper quadrant. Now I'm in the left lower quadrant. Okay, I heard vowel sounds in all 4 quadrants, and that's what I wanted to hear. And now I'm going to listen for any bruits with your aortic artery, your renal artery. That was your right renal artery. Now your left renal artery, your right iliac artery. Your right iliac artery and your left iliac artery. Okay, I heard no bruits noted, so that's good. So now I'm going to take my percussion hammer and I'm going to percuss. I'm going to start in the right lower quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. Okay, I heard general timpani around your stomach and dullness up in your liver and spleen, so that's what I wanted to hear. Okay, now I'm going to start with a light palpation. Let me know if you feel any pain. Okay, any pain?
Yeah.
Okay, now I'm going to do a deeper palpation. Let me know if you feel any pain. Okay, I did not feel any enlarged organs. I didn't feel any masses or lumps. And now I'm gonna, can you raise up for me? And can you take a deep breath in for me? Deep breath out. Good, I felt this side of your liver, and that's what I wanted to feel. It felt firm and smooth. And now, can you take another deep breath in for me? And take it out. Good, I did not feel your spleen, and that's what, that's normal. Okay, you can put your shirt down.